My name is Lior Shamai, and I'm an interventional cardiologist. I also practice general cardiology, and I've been doing so for about 12 years. I graduated from Nova Southeastern University in South Florida in 2006. I went to an internal medicine residency at Cleveland Clinic, Florida, and spent 3 years there studying, after which I did 3 years of cardiology at Ochsner Clinic in New Orleans, after which I did 1 year of interventional cardiology at William Beaumont in Royal Oak, Michigan. I'm just shy of 3 years. My anniversary, I believe, will be the 16th of September of 25, so 3 years this fall. When I was young, I always liked the science behind medicine. When I tried to look into medicine and figure out what I wanted to do, I was drawn to cardiology and specifically interventional cardiology. When I was very young, I basically shadowed for my community service hours, DMS. And one day we actually picked up a heart attack and took it to the catheterization lab in Mount Sinai in Miami. And I remember how awesome it looked when they saved that man's life. And that left a great impression on me. I thought that guy was a superhero, and when I grew up, I wanted to be a superhero just like him. One of the things that I enjoy most about my field is that there's a significant amount of variety in what I can do. I don't always do the same thing, and I actually have a large collection of toys to play with, things to do, diagnoses to deal with. And not every patient do we save lives. Sometimes we just make people feel better. And sometimes it's as simple as getting the answer for them so they can move forward with whatever's going on. So in interventional cardiology, sometimes our cases save a life. In preventative cardiology, sometimes we put the building blocks in order to prevent them from having complications years down the road. And I believe that in my field, we can make the most impact. It's the #1 killer in the Western world. And it is very important for us to educate our patients, try to explain to them why we're doing things, and give them the tools to be successful in better care and better health for the future. There's a few things that are important here. We need to combine science with compassion. The art of medicine, as they used to say, is being able to take the latest information, which we have to be up to date and know how to use and integrate. We need to have the newest tools, the newest technology available for our patients. And then we also need to understand that these are people that we're dealing with, that have families. And it is important that we take care of them in such a manner that makes them happy, makes their family happy. One of the advantages that we have here in St. Mary is we're able to bring cutting-edge technology to Enid, Oklahoma, so people don't have to travel far, which is not only important to the patient, it's also important for their family. So we can get the care for them right here. And I'm always proud when we're able to do something new that people didn't think or expect us to be able to do here. Whether it's a leadless pacemaker, whether it's a biventricular ICD or pacemaker, whatever it is that we can do. And if we are able to do that for them here successfully, I'm delighted. I do a lot of TV streaming. I watch a lot of shows. I also like to do some stuff outside. I enjoy a local shooting range. I go with friends. Essentially what other people do. I enjoy going out with friends, having a dinner and whatnot. We hold the alcohol.